It's an honor and a pleasure to present the Robert Dyer Labrador Memorial Lecture in Epidemiology today. But before I begin, I'd like to take a minute to introduce some very special guests of honor who have joined us today. My family, my sister and brother-in-law, Denise and Ron Califf, and my two nieces, Alexa and Kelsey, are here. And I'm just thrilled that you all and they could be here this afternoon. I'm a veterinarian who started off as a small animal practitioner, and I've also had a very exciting and fulfilling career in public health. When I'm asked by people as what I do, I answer that I'm a veterinarian. Then I'm usually asked, well, where do you practice? And I reply, well, I work in public health. And then I usually get a very strange look and a lot of silence. The juxtaposition of being a veterinarian and working in public health, for the most part, does not compute with most people, and many veterinarians, as a matter of fact. How can I be a veterinarian if I'm not in practice, if I'm not treating animals? And why would I ever do anything other than treat animals in a practice? Well, I thought that today I would share the professional odyssey that took me from being a small animal practitioner to that of an epidemiologist at the CDC. So you could hear about an alternative career path within the profession, and perhaps there might be something relevant in what happened with me for some of you. The bottom line is that veterinary medicine is an incredibly rich and varied profession that holds many different and exciting opportunities. The decisions I made all along the line seemed natural and right for me, but at no time in school could I have predicted what I have ended up doing. I knew I wanted to be a veterinarian as early as the 7th grade. During my interview for veterinary school, and I went to Michigan State, I was asked, why was I applying to veterinary school and not medical school? And my answer then, which is what I feel today, is that I see the world more broadly than through the view of a single species. I'm inspired by other animals we share the planet with, and I love medicine. And I wanted to care for animals, and I wanted to be a small animal practitioner. And with no question at graduation, I was going to be a small animal practitioner for life. I took a job with a small animal practice on the San Francisco Peninsula. My family had moved to California, and I followed them here. And I was very excited and happy. But I'd like to backtrack a bit because some important things happened in veterinary school, which at the time didn't seem all that important, but now later, as I look back, they actually impacted on some decisions I made along the line. In my second quarter of parasitology, I had a professor named Dr. Jeff Williams, and in class he showed us slides on the zoonotic disease in people caused by infection with the tapeworm Echinococcus granulosus. He showed pictures of himself working at the Buenos Aires Zoonosis Control Center in Argentina. And like some of the slides I'm going to show here, he explained that he and his colleagues were studying the epidemiology of the parasite and the disease in people, determining how many dogs were infected, how many people became infected from their dogs, and at that time surgery was really the only option, so it was very serious. What were the relationships between dogs and people that would put people at risk for infection, and how to keep people from becoming infected. That lecture was the first time that I saw the possibility of working internationally as a veterinarian to protect the health of people through caring for animals. And this concept blew me away. I had really not recognized this before. After class, I ran up and asked Jeff, how does one get to do this? What do you have to do? Well, when he told me that I would probably need more school beyond veterinary school, that squashed that because I was ready to be out of school and I was going to be a small animal practitioner anyways. So we let that one go. Not knowing it then, I was fortunate at Michigan State that the curriculum required all veterinary students to take small and large animal medicine and surgery 50-50, no matter what you were intending to do. We had to take a course on herd health, which was offered through the large animal department. And there we learned about population-based preventive medicine, how to measure the health of the dairy herd, what comprised a program of reproductive health, and how to sell the program to the dairy herd owner. That by the farmer's investment in immunizations and regular reproductive health services, that farmer could make some money. We also learned about the information systems that would need to be used in monitoring health outcomes and services provided under the program. At the time, it didn't seem so important. It definitely was not as fun as clinics, and I was not at all sure about its relevance to me because, after all, I was going to be a small animal practitioner. But another important event happened one day in equine medicine rotation. A horse was standing in an outpatient stanchion with the rope behind him inside the metal bars. A professor came by and asked who put this rope inside the bars, because it should always be outside the bars. So I said fine, and I undid the rope and moved it outside the bars. And sure enough, about 5 minutes later, another professor came walking by and said, all right, who put the rope outside the stanchion bars? Because the rope should always be inside the stanchion bars. And I learned right then that there must be a couple of different ways of doing things, and who knew what was right? And here were two professors, and up to that day, really, whatever professor told me was the truth. But at that moment, it was like, well, who really does know the truth? But I was going to be a small animal practitioner, so I moved on. And I was very happy and relieved when at graduation, I was able to get my first job as an associate veterinarian in a small animal practice on the San Francisco Peninsula. I finally was doing what I wanted to do, and I loved it. I was working hard, and I learned a lot from my associates, the clients, my patients. I was having a wonderful time. But I had a hankering to travel. And I wanted to go to Greece, which is where my grandparents are from. So when I had enough money saved up, I went with two friends. And when we were in Athens, we stayed with some cousins of mine that were out in the suburbs. And every day we took a bus into downtown Athens that happened to let us off at the Egyptian embassy. And there were pictures of the pyramids and the Sphinx, and there was an advertisement for a really cheap round fare airplane ticket to Cairo. So we had to go. And with no plan, we found ourselves on a plane to Egypt. By luck, we met some Americans on the plane who invited us to stay with a cousin of theirs living in Cairo. When people found out that I was a veterinarian, they became very excited and said, gee, why don't you stay in Egypt and help with the schistosomiasis control program here, which is a huge human health problem. And I remembered this was a zoonotic parasitic disease. I learned about it in parasitology, but I didn't quite remember very much about it. So, I thought, well, that sounds, I guess, like I could help, but you know, I really don't know enough. And I'm going to comment on this a little bit tomorrow, because actually this is a common feeling I think many veterinarians have. But nonetheless, I didn't feel like I knew enough, so while I was there, actually, I bought a tropical medicine textbook from an Egyptian bookstore, and I read it cover to cover. I was totally fascinated. I had been bitten and smitten by the international bug, and I really wanted to work at that point in international health. And so on return home, I went back to Michigan State and went back to that parasitology professor and said, okay, how do I go about doing this? He told me that what they really needed in international health was, yes, somebody who could give vaccinations and do those kinds of things, but what was really important was to become somebody who could help design and plan and really help to put into place effective disease prevention and control programs, and one who could evaluate the effectiveness of these programs. And when he put it that way, then I started to ask, well, gee, I think then maybe I need to go back to school, and started to inquire about schools of public health. But he knew that I was living in California at that time, and so he suggested the Master of Preventive Veterinary Medicine program at Davis, a program aimed for veterinarians, and this sounded good to me. And so I could say that I was a bit apprehensive about taking statistics. But to my great surprise, I really liked it. I was fascinated by the concept of variance from the get-go, and how it underpins all scientific biological observation and the testing of hypotheses, which is the basis of medical knowledge and scientific advancement. And learning about probability and its relationship to all parts of our lives really was fascinating and challenging mentally. And I love solving problems. I remember talking to a classmate at the time who said he was thinking of staying on for a PhD. And I thought he was crazy. I thought, hey, I'm there for the year and then I'm out. I'm going to work in an international health job. And if that doesn't work out, I'll go back to small animal practice. But the MPVM year started, and I took my first course in epidemiology from Dr. Calvin Schwabe. And as I began to learn about the health of populations in contrast to that of individuals, the importance of considering well animals in addition to sick ones in solving outbreak investigations, how to identify risk factors, and identify ways to prevent animals from becoming ill in the first place, I was won over. In particular, I remember the day I learned that just because an article was in a veterinary journal, that did not mean that the information was correct. I learned that the design and methods used to conduct a study were important to knowing whether you could believe the findings or not. And this was key because I had just spent 3 years in practice going into examining rooms and telling clients exactly what we were going to do based on the truth I had just learned after reading an article. So to find out that maybe the article wasn't right really kind of shook me up. And that was a major major day, and it really did change my life. Things just got better from there. Epidemiology, statistics, learning about all the zoonoses, immunology, I really loved it all. I always wanted to make a difference in the world, regardless of the path I took. And so learning about approaches to improving and protecting the health of a whole population of animals rather than on a one-by-one basis was just a real charge. I found that I was every bit as mentally challenged from what I was studying and learning than what I had been experiencing in practice, if not more. Toward the end of my MPVM year, Cal Schwabe told me he was looking for a PhD student who could evaluate the Echinococcus control program on Cyprus, and would I be interested in taking that on. So here was a chance to study under Cal Schwabe, in Cyprus no less. I was going to be working internationally on an important public health problem that involved animals. I forgot about anything I'd ever said about a PhD program, and I just jumped at it. From April to September 1977, I went to live and work in Cyprus to collect data from my PhD dissertation, which was on the effectiveness of the high data disease control program there. Since people get the infection from a close association with dogs, and dogs get infected by eating the cystic larval form of the tapeworm in sheep, goats, and cattle, control of the disease involves reducing the numbers of infected dogs and livestock. So I was working with the veterinary department and collected lots of data on infections in dogs, sheep, goats, pigs, cattle, slaughterhouses, land use patterns, and more. The control program, and this is a picture of the parasite to refresh some of your memories from parasitology class. The control program entailed testing all of the dogs on the island for infection 3 times a year, euthanizing infected dogs. Teams of women from the community went door to door, talking to their neighbors about the seriousness of the disease, the threat to their children, on how they became infected, and the need to control pet dogs. And controls were put into place to assure that all livestock at slaughter were inspected and that the offal would be thrown into a pit or burned rather than left out for wandering dogs to eat. And the veterinary department undertook an amazing program to eliminate all stray dogs on the island. At the start of their campaign, there were about 45,000 dogs. I'll show you a graph in a minute to show their program was quite successful. This is a graph of the stray dog population, which you can see was at like 45,000 at the start, came way down. And then some of you may remember there was a Turkish invasion that happened, so they lost some data there, but picked back up. So a very effective program. I returned to Davis in time for fall quarter, ready to finish my coursework and write my thesis. As I came toward the end of my PhD program, I began looking for jobs, and as Fred mentioned, I joined the faculty here at Davis. Right about that time, though, I attended an AVMA meeting, and there I met Dr. Peter Schanz, a veterinarian working at CDC. Peter had also gotten his PhD under Cal Schwab, was an expert in high data disease, and so we became good friends. And Peter was talking about working at the CDC and talking about the Epidemic Intelligence Service. And in fact, that was how he had gotten to work at CDC. So that was interesting, but I went back to Davis and continued to teach here. But one of my students was Dr. Nick Lurka, who many of you may know, and he had just finished EIS himself. He had worked out in a state health department for 2 years, and he described what he was doing, and that sounded great. So with these two men who I met in a relatively close period of time, both talking about EIS, I decided that was what I'd really like to do. So I called Peter and said, how do I do it? He told me who to call, how to apply, which I did, and I got in. Now, a moment or two on the EIS program. This is a 2-year on-the-job, learn-by-doing program. Veterinarians do go there, and I'll give you some statistics in a minute, but basically the majority of people who go are physicians, but they PhD epidemiologists, nurses, dentists, statisticians. This year they even took in a lawyer, I understand. But this actually is a picture of Christy Murray, who's a veterinarian at CDC, and in her EIS experience, she spent several months in Bangladesh working on the polio eradication program. So this is a picture of Christy actually giving a polio vaccination to a little child in Bangladesh. Now, since 1951, which was when EIS started, there have been 2,100 graduates, and of those, about 189 have been veterinarians. Generally, from 1 to 11 veterinarians enter each class, and the class size ranges from 60 to 90. And you either work at headquarters in a specific disease control program, or you can go out and work in a state health department on a very broad range of problems. So I moved to Atlanta to start the EIS program in 1983, and I had wanted to stay in parasitology. The only position open, however, was that of in the malaria branch. But one couldn't argue with the importance of malaria and the opportunity to work internationally would be very high. So I was very pleased when I was able to match with that position. There are some species of malaria parasites that are zoonotic, but the species that causes the most deaths in people, Plasmodium falciparum, is not, so far as we know. There are 300 million acute cases of malaria that occur annually, with an estimated 1 million deaths. It's a leading cause of mortality for children under 5 and carries with it a huge financial burden to countries. Most countries where malaria is endemic have national malaria control programs where they try to make accessible first and second line drugs available to reduce morbidity and mortality. But resistance to these drugs is increasing and spreading geographically all the time. And to complicate matters, some of the drugs countries have used in the past are cheaper than newer ones that are more effective. And for poorer countries, cost matters. So the question is then, on what basis should countries with endemic malaria base their national malaria treatment policies when they have to take effectiveness and cost into account? During my EIS years and 2 years after, I conducted field research in Africa, evaluating with ministries of health the effectiveness of these drugs. So this is where we were doing our research. For the most part was in Malawi, which is a country in southern Africa. We were working at a clinic, a rural health clinic. This is Alan Macheso, a physician assistant who was interviewing a mother, getting a history on her baby and what drugs she had given, if any, up to that time. We collected a blood smear, a sample of blood by finger stick to make a blood smear. As you can see here, we measured the parasite density. We worked right there in the clinic to give the drugs. And then we this is, my hair was not quite as gray then. This right here. We actually drove the women home so that if they didn't come for their follow-up exam, we could actually go and find the children and make sure they were okay. And we did need to do that. So on occasion, we did go to a village, and it took some sleuth work to actually track the mother and the baby down and to make sure that everything was fine. If the baby needed treatment, we did that. But then the director of CDC in 1996 really wanted to pull together what was known about the effectiveness of population-based interventions. And what do we mean by it when I say that? That means how effective are mass media campaigns? When you're on the road and you see a bus go by with a big sign on it that tries to tell you, not to have sex until you're married, or you should wear a condom, or you should stop smoking, or whatever. How effective is that in terms of overall getting the population to be practicing healthier behaviors? And then based on information that we could pull together on these interventions, there was a task force that was convened that would make recommendations. And I was asked if I would be willing to head up a team effort to actually develop this body of evidence. And so we did, and it was very challenging methodologically, because studies that looked at the effectiveness of interventions often used different study designs. They measured exposure to the intervention in different ways. They had different health outcomes they were looking at. So how to pull this together was complex. So it was a challenge, so I had to do it. It has proved very successful. But international health was calling yet again, and that's always what I've really, in the end, come back to. And as Fred mentioned, I currently serve as the Associate Director for Science and Policy. And with all these networks I've now tapped into, my job is to help build partnerships between CDC, universities, other agencies, ministries of health, the World Health Organization. And I have a very varied job. It's really quite great. So what does all this have to do then with being a veterinarian? And why did I go to veterinary school? Well, as you can see in the oath, and I feel that I can say I am using my scientific knowledge and skills for the benefit of society through the promotion of public health. Now, admittedly, I am using what I learned more out of large animal medicine than what I learned out of small. But it's been incredible, and my veterinary training has served me very well. Veterinary medicine is a human health activity, and we need to make protecting human health and well-being our first priority. And if we do that every time, we will be helping our animal patients without question. There are a number of different ways in which we can protect human health and well-being through the work that we do, which are shown on the slide. And in tomorrow's talk, I'm going to be speaking in more detail about each of these incredible opportunities to really make a difference in the world we live. And that includes companion animal medicine, too. I think you'll find it right in the middle there. There's no question that's important. But there are all these different ways that are options for all of you. Now, where do veterinarians work in public health? You might note that I've got private practitioners at the top of the list, because all of you who go into that or are working in that currently, you are at the front line. And you are right at the front line with your patients and your clients and making a real difference in their lives and their health and their well-being. However, there are those who work at local and state levels, the federal government, a number of different possibilities there, colleges of veterinary medicine, including the one we're at, industry, drug companies, and non-governmental organizations. I propose, actually, given the importance of private practice and it being on the front line, that good clinical practice actually be expanded to include, obviously, taking a very thorough history, giving a thorough physical exam, providing important preventive care services like immunizations, deworming, etc., treating animals medically as needed, but always taking care to counsel clients on the prevention of diseases and dog bites. Now, no matter what part of veterinary medicine one goes into, in addition to the clinical skills that we receive, there are other two very important areas that are actually a fundamental part of our training to do our job well that we all need, and that's epidemiology and public health. Epidemiology, I hope people will at least have heard today, and I know many of you do have it in an introductory course, It is the way that you will be able to read the medical literature and have any sense as to what you're reading, whether you can believe in it or not. And to me, that is so important, to be able to be a good practitioner, whether you're working in a clinic or whether you're working in corporate practice. And you may find yourself needing to solve an outbreak investigation even in a companion animal practice. I don't know how many of you are aware there's a substantial leishmaniasis outbreak going on in foxhounds in the eastern part of the United States right now. Or in journals you may read about risk factors for gastric torsion. This is all out of epidemiology, and unless you have a good understanding, basic understanding, you're going to have some difficulty moving forward. And public health, obviously your clients are going to ask you how to prevent them from getting diseases from their pets, but they're probably at this point going to ask you about questions about foot and mouth disease, about bovine spongiform encephalopathy, about bioterrorism, and unless you have a broader understanding of public health, you're going to have a hard time answering those questions. You're going to be a less effective practitioner than if you had that background. So what are the lessons learned then that I hope you might take away from the time we've had together this afternoon? I hope that all of you who are still in school will get the broadest training that you can. Many of you may end up doing for life what you think you're going to do right now. But I would guess that a substantial number of you will actually end up doing something different than what you swear you will be doing as you sit here this afternoon. And you just don't know. Learn all the options that are open to you. Veterinary medicine is so rich, so broad, has so many opportunities, that if you're just familiar with one part, I really feel you're losing out, no matter what you decide to do. Just learning about it in the first place with chance encounters, with new opportunities that come your way. If you learn about it now, you'll actually have some sense of who to go back to, who to ask about it, how to go forward with it. So please learn all that you can. I think as those of us working in veterinary medicine are obligated to promote public health and to put human health first in what we do. Practitioners are on the front line, and it's important they understand that role. Learn epidemiology, statistics, population medicine, and public health in addition to the clinical skills you're learning. I believe practice is important. The years that I spent in practice, I learned how to make decisions on incomplete data. And I had to be accountable for the decisions that I made. And that is what happens in public health. You often have to make a decision without having all the data. And you are going to be accountable. You are going to impact on people's lives. And that's the kind of training that you get in practice when you're alone and with that patient and with that client, and it's up to you. So practice is invaluable. Veterinarians can do anything we put our minds to. You don't necessarily need extra school, even though there are some requirements and it does help you. But you should know that you can do anything you put your mind to. It's incredible training we get, and the confidence that comes with practice, truly, even though whenever you're asked to do something, it may seem like you don't have the training or skills. In fact, you do. Just jump in and do it. You can do a good job. Seek guidance by mentors. Calvin Schwabe and Peter Schanz and several others in this room were very important to me. Jeff Williams. I asked them, how do you do this? What do you do? Where do I apply? Who do I call? And they were right there for me. Seek people who are wise and who have an interest in you and who will guide you. Interpersonal skills. The clinical skills are very important, but getting along with people, being able to work effectively on teams is very important. All right, so here's a strange case. I'm hoping by the end of these two lectures and over the years to come that the new scenario will be this. I get a question, so what do you do? Well, I'm a veterinarian and I work in public health. I've heard about the great work you guys do, and it's got to be very exciting. It is. In fact, it's one of the most exciting and fulfilling and wonderful careers anyone could undertake, and I encourage you all to consider it. Thanks very much.